Hi, my name is Leila Hughel-Deeds, and today I will be talking about Myasthenia Gravis. So we're going to go over Myasthenia Gravis, what it is, what causes it, the pathophysiology behind it, symptoms, and then treatment. We're going to go over some relevant research involving plasmapheresis, and then we'll talk about the patient, give you some background, and then the nutrition care process on that, and then just summarize it all up. So what is it? Myasthenia gravis, it is an autoimmune disease where the immune system is mistakenly attacking nerves that control muscle function. So in a normal healthy person, you're going to have electrical signals that will travel down the motor nerve to the nerve endings, and they're going to release the neurotransmitter acetylcholine, and then acetylcholine is going to be what travels to the muscle so it can bind to receptors, and the actual binding of acetylcholine to those receptors is what causes the muscle to activate and contract. And so that's in a normal, healthy person, but someone with myasthenia gravis, they're going to have antibodies that are going to be present that interfere, change, or destroy the receptors that acetylcholine would normally bind to at the neuromuscular junction. And so these alterations are going to prevent the muscles from being able to activate and contract because acetylcholine isn't able to bind how it normally would. And so what that looks like in a normal person, of course, you see acetylcholine is being released and can actively go into these receptors and stimulate the muscle. But in someone with myasthenia gravis, there are these antibodies present that are blocking it, and so acetylcholine can't get into the muscle, can't contract it, can't activate. So in a person with this condition, it would be instead of if I'm a normal, healthy person, I'm telling my brain, telling my arm to contract, it can do that. But someone with this condition, they might be telling their arm to contract, and it's just not going to go anywhere. And so a myasthenic crisis, this is when myasthenia gravis, the disease advances to an extreme state to the point where a person is so weak, muscles are so weak that they cannot even breathe alone. So they have to be placed on a ventilator, and they're on the brink of respiratory failure. And the exact trigger behind that is unclear, but they potentially think it's related to the thymus gland. And so clinical symptoms for myasthenia gravis, you see that you have a weakness of the voluntary skeletal muscles, and most common symptoms are going to include ptosis, which is going to be drooping of eyelids, diplopia, which is blurred or double vision, dysarthria, and that's going to be impaired speech, as well as weak extremities and difficulty swallowing. And then when this gets advanced to a myasthenic crisis, it's going to be a life-threatening weakness of your muscles, so extreme state. And the most common things that come along with that are going to be dysphagia, which means you can't swallow, breathing difficulties, which is why you're going to be placed on the ventilator. And then you're going to have a drooping head, facial paralysis, and fatigue could also come along. So treatment, currently there is no cure for myasthenia gravis, and so there are just 3 different therapies that are done. So the first one is a thymectomy. So this is just removal of the thymus gland. So when someone has myasthenia gravis, their thymus gland is enlarged, and typically just removing the thymus gland altogether can greatly reduce some of those symptoms that come along with the disease, and in some cases even rebalance that immune system. And so then the second one, you see some medications. We have anticholinesterase or an immunosuppressant. So what these are going to do is just suppress the production of those abnormal antibodies that are blocking acetylcholine from being able to bind to the receptors. And so it's just going to help suppress that and give acetylcholine more of a chance to activate and contract the muscle. And the last one is one of the newer treatments, and so this is called therapeutic plasma exchange. It's also known as plasmapheresis, and it's actually this machine right here. So what they would do, the patient would be hooked up to this machine, and it's going to pull out their blood, and it's going to separate the plasma and the serum. And so they're separating the plasma to get rid of it because typically when someone's in a myasthenic crisis state, there's so many bad antibodies filling up their plasma that it's just uncontrollable. And so they want to take out that bad plasma and then just get rid of that. We don't need that. And then they're going to put healthy plasma back into the machine and remix that with the other part, so the serum, and then blood is going to be put back into the patient. So it's just a big cycle, getting rid of that plasma with the bad antibodies, putting good plasma in and putting it back into the patient. And so some research, there was a study called An Emerging Treatment Modality in Patients with Neurological Disease. It was published in the Journal of Clinical and Diagnostic Research in 2017. And so for this study, they did a retrospective analysis over a 9-year time span on 161 patients aged 2 to 75, and they wanted to examine if plasmapheresis, which is going to be that TPE, should be a primary treatment for patients. And so they took patients that had one of these 2 conditions, and then they just wanted to look at people with myasthenia gravis because, again, they wanted to use plasmapheresis, which is going to be used for that disease. And so they wanted to look at the indications, complications, and outcomes from doing plasmapheresis. And so what they found, indications it should only be done on patients with a severe need in their plasma. So plasmapheresis, it is very hard on the body, so the patient is going to be hooked up to this machine for at least 3 days. And so you got to think, if you're in that crisis state and need plasmapheresis, you're in such a weakened state, you can't even breathe, you're on a ventilator, and you've probably just been worsening over time, you're lethargic, not feeling great. And so you only want to do it if the patient really needs it, because it's going to be very taxing on the body when it's already in a very weakened state already. But there's also a long-term maintenance availability, again, putting that healthy plasma back in, and then you can always be rehooked up to that machine and kind of get the bad antibodies out. Complications, of course, machine error can always occur, and then adverse reactions due to hypotension, fever, chills, nausea, or allergic reactions as well could occur. And then outcome-wise, though, from this study, they didn't have any mortality from performing plasmapheresis on those patients, and they saw effects within 24 hours, which is huge, because if they're hooked up to this machine for at least 72 hours, to see a positive impact within 24 hours is, I mean, it's life-saving for these patients, because this is a life-threatening condition, and so that's really exciting to see. And it also is just a new way that's utilizing technological advances, and it's shown to be successful from this study. So limitations, it is data only from a single center, so that's definitely a limitation, needs to be duplicated. But overall, you can see that plasmapheresis, majority responded well. It was cheaper than other available therapy treatments, again, like removing the thymus gland or taking medications. Those medications, of course, you'd be taking that for life or in intense stages, which is going to add up over time. And it was safe for all ages. Again, this study had a very wide age range that they looked at, and no mortality, and so you can see that it worked on everybody. And so what we're going to be looking at today is Mr. W. So he is a 55-year-old African-American male, 6'2", 102.6 kilograms, and he presented to the ICU. He was admitted for having myasthenia gravis. He had had that since 2002, and his disease had advanced to a myasthenic crisis, and the symptoms that he originally presented with were lethargy, shortness of breath, and no appetite. And so he was placed on a ventilator with the plan to start plasmapheresis, again, because he's advancing to that crisis stage. And then lab-wise monitoring, he had an elevated BNP, which could be related to a weakened heart state. Again, if he's in this crisis, he's not breathing well. Again, extremely fatigued, shortness of breath, so a lot of pressure and stress is going to be on his heart, which could cause the BNP to be elevated. And then he had a decreased total protein and phosphorus, and that could be related to the lack of appetite he'd had. I mean, he's had myasthenia gravis for a while, and it had been worsening to this crisis state. And so, of course, when you don't feel good, you're not going to be wanting to eat. And if this had been going on for a while, of course, the protein, phosphorus, these major nutrients are just going to be a little bit lowered. And that's something that, as a registered dietitian, that we would